Questions about the president's health in the last couple days.
Sir, could you tell us the president's oxygen saturation level, please?
Yeah, so the last saturation that we had up walking around, he was about 96%.
And he's receiving he has not received any supplemental oxygen?
He's not on oxygen right now, that's right.
He has not received any at all?
He's not needed any this morning today at all. That's right.
Do you have an estimated date when he might be discharged?
Well, I don't want to put a hard date on that. He's doing so well, but with a known course of the illness, days 7 to 10, we get really concerned about the inflammatory phase 2. Given that we provided some of these advanced therapies so early in the course, a little bit earlier than most of the patients we know and follow, it's hard to tell where he is on that course, and so every day we're evaluating, does he need to be here, what does he need, and where's he going.
What do you see as a probability that he will need supplemental oxygen going forward?
I don't want to put a percentage on that, but right now all indicators are that he'll remain off of oxygen going forward.
And in terms of like blood clots, pneumonia, bacterial infection, what do you see as the risk on that front?
Well, we know that all of them are risks associated with this condition. He is receiving all of the standard of care and beyond per routine, international COVID protocols. So we're monitoring for all of that, but at the moment, there's no cause for concern.
You said he's fever-free now. What was his fever when he had one, sir?
I'd rather not give any specific numbers, but he did have a fever Thursday into Friday, and since Friday morning, he's had none.
Okay. And what was the date?
On top of the other antibodies.
I'm sorry?
Why remdesivir on top of the antibodies?
So remdesivir works a little bit differently than the antibodies. We're maximizing all aspects of his care, attacking this virus, a multi-pronged approach. As the president, I didn't want to hold anything back. If there was any possibility that it would add value to his care and expedite his return, I wanted to take it. And the team agreed, and that's why we proceeded.
Doctor, what was the date of the president's last negative test?
I'm not going to get into all the testing going back, but he and all the staff routinely are tested, and so.
Doctor, what is the PPE protocol for President Trump receiving visitors and doctors?
It's the same as any hospital has. We have an area that's clean, that you put your equipment on, and then beyond that, everybody is fully gowned up, masks, gloves. We're protecting ourselves and him.
Have you done a screen? Has there been any sign of any lung damage whatsoever?
We are following all of that. We do daily ultrasounds. We do daily lab work. The team is tracking all of that.
Has there been any sign of damage, sir?
I'm not going to go into specifics on what the findings of any of that are.
If we just put you down on one thing, has he ever been on supplemental oxygen?
Right now, he is not on oxygen.
I know you keep saying right now, but should we read into the fact that he had been previously?
Yesterday and today, he was not on oxygen.
So he has not been on it during his COVID treatment?
He's not on oxygen right now.
Has hydroxychloroquine been considered as a viable treatment option for the president?
We discussed it. He asked about it. He's not on it now.
And in terms of symptoms, has he also experienced difficulty breathing?
No, he has not. Never did. He had a little cough. He had the fever. More than anything, he's felt run down.
Who is handling contact tracing? Is that the White House or CDC?
The White House Medical Unit, in conjunction with in collaboration with CDC and local, state, and health departments, are conducting all contact tracing per CDC guidelines.
When was the positive diagnosis made? You said 72 hours. That would put that Wednesday.
Yeah. So Thursday afternoon, following the news of a close contact, is when we repeated testing. And given kind of clinical indications, add a little bit more concern, and that's when late that night we got the PCR confirmation that he was.
Is there any clarity on how he became infected?
Not going to go into that. As far as his care, it's irrelevant.
Or when he became infected?
Yeah, we're not going to go into that. We're just tracking his clinical course and providing the best care we can.
Will President Trump have to stay at Walter Reed to get the 5-day remdesivir treatment?
We've discussed that right now. If he needs all 5 days, that will likely be the course. But again, every day we're reviewing with the team his needs for being here. And as soon as he gets to the point where it's not a requirement, he may still need some care, but if we can provide that downtown at the house, then we will transition at that point, as long as it's safe and appropriate and the team agrees.
In addition to his weight, does he have any other risk factors that make him more at risk for sort of a severe case?
Well, not particularly. I mean, he's 74, he's male, and he is slightly overweight. Other than that, he's very healthy. His cholesterol is great, his blood pressure is great, he's not on medication for that. He's up and active. You saw his activity, the days leading up to, the long hours and everything else. He's able to handle it.
Can you provide other vitals like heart rate, blood pressure, and temperature?
So his heart rate is in the 70s to 80s. His blood pressure has remained where it's historically been during our physicals. 110 to 120 systolic. He's great. It's never budged. I've had no concerns there.
So why was the decision made to transfer him here?
Because he's the President of the United States.
And obviously, if doctors have found that the prone position is helpful for COVID, has he been in that at all?
No, he asked about that. He did, Thursday into Friday. He's been briefed by the task force and all the scientists for months. And he brought that up, as we were discussing his cough. And at that time, his oxygen levels were okay, and we didn't feel like we needed to do it. We came up here, we discussed it with the team as well. We consider all options, but he has not needed any of that.
Why wasn't the First Lady admitted as well?
The First Lady's doing great. Thanks for asking. She has no indication for hospitalization, advanced therapy. She's convalescing at home. Thank you.
I'm going to try to pin you down one more time. I know you said there was no oxygen
He's not on oxygen
but did he receive
today.
Did he receive any on Thursday?
And what's today? Saturday? No, Thursday.
Okay, so no Thursday, no Friday, no Saturday. That's fine.
So
that was why we were confused.
Thursday, no oxygen, none at this moment. Yeah, and yesterday with the team, while we were all here, he was not on oxygen.
So has the president actually been admitted as a patient to this hospital?
The president is a patient at Walter Reed National Military Medical Center.
Is he on any steroids?
See?
Press, thank you.
Thank you very much.
Last question. Thank you. John. Okay, thank you.
There, Dr. Sean Connolly and the President's medical team there from Walter Reed Medical Center, a team of pulmonary and infectious disease specialists. What we heard from the doctor, who's a doctor of osteopathy, osteopathic medicine, former Navy officer as well, is that they're extremely happy with the President's progress, that after the treatments he's gotten, he says the fatigue and coughing are resolving and improving. Said that the President's oxygen levels at around 96 are normal. Has not given a date of discharge yet, but he reports that the President said he feels like he could walk out of here today. Let's bring in our doctor now, Jen Ashton, for more on this. Jen, what stuck out at you?
Well, first, George, let's look at the team taking care of the president. 7 doctors, including what we call intensivists. These are doctors who have special advanced training in critical care. Oftentimes, they are also pulmonologists or lung specialists. You have several infectious disease physicians, an anesthesiologist, a team of 5 nurses, and a clinical pharmacologist. That is what we call a stacked medical team. You heard them talk about the first 7 to 10 days of COVID illness being the most critical. He is 72 hours in. Absolutely a good sign that he is not requiring supplemental oxygen right now. I do want to dial into some information that they provided about what we call the O2 saturation or the oxygen saturation. Right. When he's walking around at 96%, it doesn't really stay at one level. If it goes to 94, 95, that's a little lower than you would expect and not unexpected with COVID-19. But we've seen a lot of patients with COVID who have slightly low oxygen
when my wife
saturation.
Had it, the concern was if it went down below, to around 92 or below, that's when he started to get a little worried.
Exactly. So nothing really alarming there. What's really important, George, is the care the president is getting. He's gotten both immune therapy with the Regeneron antibody cocktail, as well as antiviral therapy with remdesivir, which is normally a 5-day course. His doctors are being aggressive with treating early on in the course of disease. Usually we've heard of remdesivir being given to more moderately or severely ill patients, and they are giving it early in his course. And you heard what I thought was the best quote of that press conference, why he's getting these treatments, because he's the president of the United States.
Right, and also he says fever-free for 24 hours, no date of discharge from the doctors yet. You mentioned that 72-hour figure. How do they know it's been 72 hours? They know the test was on Thursday afternoon, which is 48 hours ago or so.
Exactly. So remember that with any patient, George, there's always confidentiality issues. So that timeline is a little vague. But I do also want to mention the kind of observation that is being provided at Walter Reed, because most people can imagine that at the White House, they're able to monitor his oxygen saturation. They're able to give intravenous fluids and things of that nature. In a critical care setting, you're typically monitoring EKG or cardiac function on a telemetry unit. They are doing regular blood tests to check his liver and kidney function, because some of the drugs he's on, particularly remdesivir, can affect kidney and liver function. And he is being rounded on by this medical team several times a day. So you heard it, that some of this treatment may be continued in the outpatient setting, which of course his outpatient setting is the White House, where they have quite a lot of resources. Other things they're going to be watching for is a risk of blood clots, which we know can occur in patients with COVID. They mentioned he's ambulating, walking around. He may also be on some prophylactic blood thinner, which again is pretty standard now with COVID care.
Two more questions. The doctors seem to be dancing around whether the president had ever been given oxygen. He said he's not getting oxygen right now. He wasn't given oxygen on Thursday, and then when asked about yesterday, he said he wasn't given oxygen when the president was with the team, which was not a yes or a no.
Yeah, I mean, to me, George, that kind of sounded like at some point he very well may have been administered some oxygen. But I will tell you that in either an outpatient setting like the White House or a hospital setting, people get nasal cannula oxygen almost when they arrive and walk through the door. So I certainly wouldn't find that out of the ordinary or an alarming sign if, in fact, he had gotten some supplemental oxygen. It doesn't really do that much if it's just those little nasal pronged, but again, with a 74-year-old man, it would be pretty standard, and it would not surprise me at all.
Finally, the doctor mentioned the danger zone, the 7 to 10 days is the most critical, so we're about, 3 or 4 days out from the 7 days.
Right, and I think we need to remember here, George, we've only known this virus for 9 months. It's shown a lot of mysterious features and a lot of clinical twists and turns. And in medicine, we can only go by the assessment right now and prepare for things down the road in case they may happen. So that anticipation and that observation period is really important in the clinical realm of medicine. And of course, again, estimates are that as many as 10% or more of patients with COVID-19 may even suffer that long haul syndrome and have some degree of symptoms lasting weeks or even months. It is way too early to look down the road that far. Certainly in an inpatient hospitalized setting, we're looking at patients basically hour by hour.
Okay, Jen Ashton, thanks very much. Let's bring in Cecilia Vega as well, our senior White House correspondent. She's at Walter Reed right now. So Cecilia, apparently the president got this test now Thursday afternoon. We know what we also know about Thursday is that that's when Hope Hicks that morning, his close aide, tested positive that morning. And the White House and the president chose to continue to go on to that series of meetings in New Jersey with both a fundraiser and a roundtable after knowing that Hope Hicks had tested positive and when they knew the president was about to get a test and was symptomatic in some level.
Yeah, George, the message here from the doctor, and excuse me here because the traffic is very loud on this road, but the message here from the doctor today at Walter Reed was very much, and you would assume that the president had something to do with this, that it is as business as usual as much as can be as possible there in the hospital, that the president is still doing work, that the president is very well, that they are extremely happy with this progress. But you said it. Right now, there is a very alarming thing happening with the circle around President Trump and the growing number of positive cases that we are seeing. You mentioned Hope Hicks. We just learned that former New Jersey Chris Christie, an ABC News contributor, has tested positive. We know that he was in the debate prep with the president. We know that he was there in that Rose Garden event a week ago today where the president announced his pick for the Supreme Court justice for Ruth Bader Ginsburg's replacement, Amy Coney Barrett. The big question right now, George, is whether that event that happened there in the Rose Garden has become a super spreader event. We know that Kellyanne Conway overnight announced that she also tested positive. She's experiencing mild symptoms. She also was at that event. And the list goes on, George. 2 Republican senators, one from North Carolina, Tom Tillis, another from Utah, Mike Lee. They've also tested positive as a result of that. And then the circle that's growing, the Republican Party chair, she's now tested positive. The campaign manager, George, this list just goes on, in addition to a number of journalists who cover this administration. So there are serious questions this morning about the contact tracing that is happening and whether this list of names that is now testing positive close to the president are growing as well. And George, we should also reiterate something the doctor said here before we go, that the First Lady has no indications that she needs to be hospitalized at this time after having tested positive as well.
Thank goodness for that. Okay, Cecilia, thanks very much. Let's bring in Rachel Scott. Rachel Scott, we're going to be hearing from the president's campaign this afternoon on how they're going to be going forward.
We are, George. We're expecting an announcement later this afternoon about how they do plan to move forward in light of the president's diagnosis. We know that the vice president, Mike Pence, is expected to be back on the campaign trail, expected to touch down in Arizona just one day after the vice presidential debate, which is still planned to go. But, George, I just want to highlight one thing that Cecilia said. Right now, you have a scenario where not only the president has tested positive, but the RNC chairwoman and also the president's campaign manager, George.
It is not over yet, but for now, the president's doctor says they are extremely happy with his progress. No prognosis on when he's going to be leaving the hospital. We're going to stay on top of it, of course. For now, we return to your regular programming.
This has been a special report from ABC News.
In front of Stacey Abrams, boy! The Blackish Special, Sunday on ABC.